Namaste, I am Nivedita and I take the pleasure of interviewing and introducing to a unique personality accredited with twin degrees in medicine and law. He has acquired 4 gold medals during his law course. A qualified surgeon, he has one more feather to his cap, that is FRCS from Glasgow, UK. He has the dual advantage of operating on diseased human body and a diseased society as well. He plans to integrate the white apron of medicine and the black coat of law into a new suit, that is of a teacher, especially in the area of medical negligence, medical jurisprudence, clinical forensic medicine and elite subjects. He has also established an organization with an objective to encourage, promote, perpetuate better and stable relationship in the institution of marriage so as to reinforce family and to strive exclusively for men's right. A warm welcome to Dr. Ponnappa.
Namaskar, thank you.
Doctor, can you please say a few words about your profession which you are now doing?
Yeah, sure. I'm basically a doctor.
Yes.
And I'm MBBS from Mysore University.
Okay.
And I've done my post-graduation in general surgery from Madras.
Okay.
And then I did my fellowship of the Royal College of Surgeons from the Glasgow, UK. And I was a consultant surgeon in the West Indies, Caribbean Islands. And then since 2004, I am a consultant surgeon in Mission Hospital, Mysore. And I handle a lot of traumatology cases and general surgical cases. And I'm happy with the doctor's profession. We'll have to see what else I would do. But as the interview goes, I think you'll know more of me, I guess.
Okay. So, we know that it's a very difficult nowadays to pursue 2 professional degrees.
Yes.
What interested you to pursue law?
Well, now that you tell that I have a dual profession, it's really an honor and a privilege to have dual profession. When people are finding difficult in managing one profession, I'm managing 2 professions. Whether I'm really managing those 2 professions or more, I'll tell you now. The thing is, I got married and the marriage went sour. It was a broken marriage. And not just a broken marriage, I was exposed to unnecessary litigation. There was a dowry harassment case hoisted on me. I went through divorce. I'm now fighting a custody battle and then maintenance and all these things. But why me? That was my question. I was a happily married, so to say, surgeon with a lot of money, status, profession, dignity, everything. But why this our marriage and litigation? When I was subjected to this sort of harassment, I studied some books on law. What this law states about these provisions. Then I found it was totally a disfigured thing which has happened to me in life. This should not have happened, but it did happen. The reason best known to people involved here. Right. That prompted me to study law. I wanted to protect myself and my family. As I told you, a criminal case of dowry harassment was hoisted on me and my parents. And according to the law, I'm an accused person and I'll have to go to jail or get bail and defend myself. You know, I had to go for an anticipatory bail for which I had to pay money. I had to go for regular bail for which I had to pay money. If I don't get bail, I'll have to go to jail. Why suddenly my freedom is curtailed? And what the law says, what the lawyer says, what the police say, what the system says, I was worried. I didn't know where to go, whom to ask. I was running from pillar to post. That prompted me to study law. It was in fact not out of pleasure I studied law. There was someone holding a gun to my head and said, look, you are in dire trouble, you better defend yourself. And I could not rely on people who are supposed to protect me. So I had to study law at least to know, and definitely to protect myself and my parents, I had to study law.
Okay. So you studied law and you have also bagged 4 gold medals and also you were the first rank holder in law.
Yes.
So that means you had a very tough time studying. So could you please say a few words on how did you study and how was your study pattern?
Well, honestly speaking, I didn't have a study pattern, I should say so. But as I told you, so I was in trouble. I need to get out of it, and I had to sustain. So for sustenance, I had my profession that gave me money, earnings, and all those things. Now I had to defend myself. I had to pay the lawyer's fees, travel, maintenance, and all those things. I had to study law for that. And what if I am not successful? If I am not up to the expectations? When that thing happens, I'll have to shell out money, I'll have to go to jail. All these things are right in front of me. When you are facing an adversary and you think you're going to lose, you only have to fight back. And that was the inspiration which I think I had in me. I had to fight the system, I had to defend myself. That was the thing which was driving force all through my I think LLB career. When I started studying with my students, meaning students means the classmates, I was a little odd. I was a 36-year-old man sitting with say 20, 21-year-old boys and girls. It was a little sort of irksome for me. But I had the motivation which I think the others lacked. And when I finished my work at hospital, I had to come back home and then study my legal curriculum. And then early morning between 8 to 2 I had my college. I had to operate. So I cannot definitely tell you what my study timing and pattern was. But definitely I found where there's a will, there's a way. That's a popular saying. So I had a will which was enforced on me. So I had to find a way, and I found it, I guess.
But it looks like somebody is suffering with all, you had so much of the family problems with you, the court cases, all that. Now you say that it was a motivation for you to study and driving force for you to study. But people always give excuses to study, saying that, oh, I have this problem, I can't study, I can't concentrate. So how was it possible for you?
As you rightly said, people give an excuse, right? So I think in my case there was a pressure on me. I could not give excuse, because if I give excuse, I'll be inside. I would not be outside as with a free man. I would not be with my freedom. So that was the pressure which I had. And the next thing is, you see, people are usually contented with what they have.
Oh, yes.
I studied, I have one degree, I have one profession, I have some money, okay, enough for me. But I think Providence had something different for me. Now I had one profession which is wearing a white coat and treating patients and people suffering, pain. And the other side, now I am studying law, wearing a black coat which is exactly opposite to the white color, which is black. And now I am operating on the society, so to say. So I didn't find much difference. And what I would think, everyone should have the determination. They should not be contented with what they have. You should drive more. What if it is one profession? It may be two professions, more professions. Why not? When that urge should be there to achieve, which I didn't have. Maybe the marriage taught me a lesson. My ex-wife, I should thank her, because if it was not for this our marriage, it would not have been an inspiration for me today to achieve this feat. I think I should thank her.
So we always say that there's a woman behind every man's success.
Sure, that I think amen to that. Yes, definitely.
So it is leading for your success.
Yes, definitely.
Okay. So now that you said your age was around 36 when you studied your law course. Do you think the age factor counts for studies, or carrying out a professional courses or pursuing studies?
I think I'll say an yes and a no also, because law is always like this. So you want an yes and no answer, I'll give an yes and no answer. Thing is, age is not a factor technically, because even at the age of 90, 100, I think recently I read in a newspaper an old lady graduated or something like that, of course in the West. That should not be a problem. In fact, science says we utilize only about say 3 to 10% of our capacity, brain capacity. So the rest 90 is going down the drain. We better make use of it. If we exercise our brains, I think all diseases and all those things will be kept at bay. If we don't, we are going to suffer. That's one. That is regarding the age. And the second aspect of age is, I had seen life. I had exposed myself to the profession of medicine. I have seen patients suffering. the laws and rules and all those things. I had been abroad, and matrimonial problems, seen the jail, police stations and courts, lawyers, everything I was exposed. That gave me an edge.
Okay.
So, which the 21-year or 22-year-old girl or a boy in college will not be exposed to. They'll have to read it theoretically. Yeah. For me, I had an experience there. So, I think that gave me an edge. Yeah, age was and not a factor.
Okay. So, now you are professionally a lawyer and professionally a doctor. So, now that you have the 2 degrees in your hands, that is medicine and law.
Yes.
So, in future, which one would you pursue? Like, which one would you follow, practice?
Yeah, I think I'll make a small correction to your statement. I am professionally a doctor, not professionally a lawyer. I am a law graduate, because in this country we are not allowed to practice dual profession.
Oh, okay.
But why not?
Yes.
When I have the freedom to study, why shouldn't I practice 2 professions? Of course, there are some guidelines by the Supreme Court, and there are some professional bodies say we cannot dedicate our full time for the sake of the profession. So, suppose I am operating and tomorrow I have a law case coming up. So, I will be concentrating here and I cannot concentrate on law. So, that may be the reason why the system has developed that you cannot have 2 professions. But that is to practice that sort of a profession. But there may always be some gray areas where you can integrate the 2 professions. I am looking at that angle. Now, I am thinking of moving the appropriate courts to see if I can be given limited registration purpose to practice both the professions.
Both the professions.
So, I may not be given, but I still have to give it. But how I have come across or come through this legal janjat is, yes, I am a doctor and a law graduate. I know something about the law. I can integrate it to teach both medicine and law, where they have an interface, say like medical negligence, medical jurisprudence, clinical forensic medicines, and of course my favorite subject is matrimonial laws. So, I think I know a little more than what the lawyers know, because I am personally a victim of this. So, I thought I should give my knowledge and share with people. That way, integrate both medicine and law. Still, I can have the dual profession.
You are mentioning about the integration of the your profession of law and medicine. Could you please emphasize on the integration part, that is the medical jurisprudence? Give few case studies.
Yeah, I think I can tell what it means by medical negligence and medical jurisprudence, clinical forensic medicines, and all the same. These are a little a new terminology, so to say, for the general public. Medical negligence means negligence everyone knows when we are negligent. Medical, when it is done by a doctor. So, all the patients need not go home properly, successfully treated and all those things. So, there is a saying, doctors operated and patient died. That's also there. And doctor is a second yama. That is also there. But not all doctors, or no doctor for that matter, will try to kill a person or maim a person or a patient. It does happen. So, all cases of mishaps cannot be termed negligence. So, that needs to be a little polished. I think the medical profession will know, but the legal profession, the consumer courts and the Supreme Court and High Court have brought beautiful decisions on that, not to trouble doctors unnecessarily. I think we need to create more education on that front. And coming to medical jurisprudence, it is again integration of medical and law. Suppose there is a crime, how to use the medical field for the legal purpose. So, again in our medical teaching, when we are students, we are not taught about how to maintain records, how to document a injury and all those things, what happens in court, and many of the cases will have this lacunae, and eventually the real culprit might escape, or the person who really wants benefit will not get the benefit out of the system. So, I am trying to educate, I will hope so, try to educate doctors to maintain records and how to help the legal system.
Do you think all the doctors would have educated before they enter into ICU or enter into this profession?
Well, I think it is, we learn more out of on the job. We have a course in forensic medicine. But when it comes to practice, just like any other subject, theory is different from practice. We know a lot of theory, but theory will not be of any use when we practice. So, I think that is a handicap, which I thought is a grey area. I think I should integrate both medicine and law, the knowledge which I know, into this field. And clinical forensic medicine is another new subject which is not very much active in India. Abroad, Australia and all those things, they have a system itself, but we don't have. Probably that's another area which I can look. So essentially what I'm trying to say is, we should not be happy with what we have.
Yeah.
If you have the potential, if you have the motivation, you should do it. You should go for it.
Okay.
Yeah.
I think you have started an organization called as Pure,
Yes.
that is for the men's right.
Yeah.
Could you say more on the organization?
Yeah. Sure. Pure is an organization for family rights first and then men's rights.
Okay.
Why we have named it Pure is, it's people's urge for rights and equity.
Okay.
So equity is different from equality, so to say. Our constitution gives under Article 14 equality for everyone, meaning equality before law and equal protection of laws.
Okay.
But somewhere down the line it gets diluted and say man and woman are equal. When that concept comes, ego clashes will be there, and the person or the institution which suffers more out of it is marriage.
Okay.
And I am a living example of the exposure to such laws, and my marriage was ended in divorce. Son who was supposed to be, he is with the mother. I don't have him. So why should this happen to the society? Shouldn't we as a society, we boast of our Hindu traditions, Indian traditions and all those things, but somewhere we have been taken over by some other foreign power, alien power. No religion in our system says husband and wife should be separate. It is a union of both forces, yin and yang. Both negative and positive forces should culminate in one, that's family or and husband and wife. But here certain laws are breaking the family. So on that aspect I thought we should add more, and when a complaint is hoisted, dowry harassment or maintenance, it is just, as I said, harassment. The Supreme Court of India itself has told it is legal terrorism.
Okay.
So 498A is legal terrorism. Again, coming to maintenance, the feminists say we are in a patriarchal society and women are sort of harassed. They have been pushed and walked all over. They were seen as only baby making machines and things like that. But now the tables have turned. Now men are really the handicapped person. Maintenance issue when it comes, when a woman is equal, why give maintenance? A person who has studied, why should she claim maintenance from the ex-husband or the present husband? In fact, the law says for the maintenance purpose, even a divorced wife is entitled for maintenance. So these are provisions which are made 100 years ago in those patriarchal societies, so to say. Why in this present era, the empowered woman should claim a man's money? So that's a dichotomy which we have here, which needs to be addressed. So these are certain things. We can have free counseling here. We advise people what to do when there is an arrest, what to do when there is a matrimonial case, divorce, conjugal restitution of conjugal rights, maintenance, child custody, whatever bits and pieces I know, and people similar situation which they have exposed, we try to help patients.
I think you have also organized a few workshops, seminars on your men's right?
Yeah, not again I would say it's not men's rights. Men's right is part of this movement.
Okay.
Family is the punchline here. We are trying to save the families. We have conducted certain programs highlighting all these things. Here you see, when I say men's right or this abuse of legal provisions, women are also paying for it, because the law sees only daughter-in-law as the victim. A mother-in-law is there, a sister-in-law, an aunt, a niece, a small child. In Bombay, a 2-year-old girl had to go for an anticipatory bail because the girl had filed in her complaint, the 2-year-old girl's name also was written. So the baby had to take a bail. That is what the papers say. So why should this happen? From statistics I understand about 1,24,000 women are in jails without trial because of this 498A. Why? Why should women suffer because of another woman? Is this equality? Where is our law going? Where is our society going? We should give a thought about this. So I am trying to, by conducting these conferences and seminars, I am trying to enlighten people. Look, women are also being suffering because of this law made for women. So those are the things which we are highlighting. And for that matter, we don't have a men's ministry. We don't have a men's welfare association or organization. Many men commit suicide, married men commit suicide, and 80 to 85% of the income tax is paid by men, but still we are second citizens. where it's a patriarchal society.
Okay.
And women, when they don't have 33% reservation, all these laws which are against men are made by men. Are we in a patriarchal society? This needs to be addressed. Those days, my grandparents' time, women were probably troubled.
Yeah.
And we have statistics. Somehow when a woman is there, sexual politics will come to home. Everyone will plunge, media will come, people will come, social organization will come. But when the man is again in the same position, no one is there to help him. He is there to fend for himself. I think there Pure wants to come in and help such people and try to bring a balance in this society.
Success in life can never be an accident. It's a result of right decision at the right time. Winners are not people who never fail, but people who never quit. Here we have an ideal example in Dr. Ponnappa. On behalf of the viewers, I thank Dr. Ponnappa for sparing his valuable time with us. And I also thank the viewers for watching this program. Thank you very much. Thank you,
very
Doctor.
much. It's a pleasure being here.
Thank you.